Hello, welcome to yet another video of Acharya Academy. Today, in this particular video, I am going to discuss how to study Ayurveda in a simpler way. Right? Before going into the description, we need to know about some of the concepts. First, if you know about the physics, chemistry, and biology and fundamentals of Ayurveda, then any of the information can be learned with the deepest understanding. Second, if you are learning any of the new concepts, then you need to practice the concept of minimalism. What is this particular minimalism? Minimalism, we are going to take one particular small topic and we are going from the all the directions on that particular topic. So that means we are going to do brainstorming session of that particular topic. So that means we are going to have many informations gathered on that particular small topic from the point of anatomy, from the point of physiology, from the point of biochemistry, from the point of like that, from the point of Rachana Sharira, from the point of Kriya Sharira, from the point of Roganidana, from the point of Dravya Guna, etc. etc. We are going to learn this particular concept on one particular small topic there. So that is practice of minimalism helps a lot there. Third, if you know about the each and every corner of Kriya Sharira, then learning Roganidana is not at all difficult. If you are knowing about the concept of Roganidana from each and every corner, then learning Kaya Chikitsa is not at all a difficult thing. It's very easy. Fourth, whenever if you are learning any particular topic, we have to identify the patterns. And so that we can able to modify the patterns and we can able to create the patterns also. Let me give you an example. As usual, if a person is taking the sour milk or sour buttermilk or sour curds from the for a period of 7 or 8 days at night time before going to bed, what will be the outcome? As it is sour, that is responsible for the increase of pitta dosha in the body. So if the person is continuously consuming that, it's a pattern there. At night time he is consuming sour buttermilk or sour curds. That is the pattern identification. So which will be is responsible for specific symptoms which are related to pitta dosha. When the time arises, we are going to learn those informations. Right? So when you look into that, the pitta dosha is increased by looking into these sour buttermilk consumption. Then what you have to modify there to have the balance of the increased pitta dosha there? Then first and foremost thing, you have to avoid this particular sour buttermilk. That's a pattern modification. And apart from that, you have to give the diet which is devoid of the pitta vitiating factor there. For example, simple milk with little bit amount of warm water or with little bit amount of water there. That is a pattern creation. First of all, pattern identification, sour buttermilk consumption, then pattern modification, avoiding this particular sour buttermilk, and pattern creation, increasing the substances or consuming the substances which are responsible for the pacification of pitta dosha. That is simple milk consumption there. This is about the these are the motto of this particular academy: identifying the pattern, modify the pattern, and create the pattern. And last point, no compromise will be taken, no compromise will be done in learning Ayurveda fundamentals while discussing about the physics, chemistry, and biology and Ayurveda fundamentals. Right? With this particular small concept understanding, we are going to learn the today's topic there regarding the how to learn Ayurveda. So first of all, Ayurveda is like learning a new language. So whenever if you are learning a new language, it requires much effort from the person who from the learner side. He has to give that much effort, then only he can able to learn the new language there. So that is, it is like you need to know about the Ayurveda informations, you need to know about the Western informations also. So it is just like looking into these particular railway tracks. See, there are two railway tracks. On one particular railway track may be confirmatory or may be related to Ayurveda information. On the other, uh, on the other railway track, that is indicative of Western information. So you have to learn Ayurveda information as it is, and you have to learn Western information as it is. When you are going into the next step, see there are little bit connections there from the to the both these particular railway tracks. So that is what is bridging the information of Ayurveda information and Western information. So in that way, so you have to move ahead whenever if you are learning the the Ayurveda there. Because we are most of us are actually ignorant about the Ayurveda knowledge, and most of us are knowing about the Western knowledge. In that particular situation, the ideal way is, so we are knowing the Western information. Based on that, we are going to add the Ayurveda information in the Ayurveda way and bridge the two informations there. So to know this particular information very well, we are going to discuss about the three examples. So one that is Medakshaya. Medakshaya means there will be a fat loss from the body, and Pliha Vriddhi. Pliha Vriddhi, it's an organ which is considered to be spleen enlargement. How this is Medakshaya is responsible for Pliha Vriddhi? Pliha Vriddhi. Is there any understanding from the current point of view? Can we make out? Let us see. Second basic information, that is Vyayama and Vata Prakopa. I think this one we have discussed previously, but here I am going to discuss a new different approach there. And third example I would like to give, Pranavaha Sroto affliction. That is the person who is that is what is considered to be the prana. Pranavaha Srotas, that is the channels which are carrying the prana. Its affliction and its relation between the Vyayama, that is exercise. So we are going to discuss these three examples. First example, that is Medakshaya and Pliha Vritti. What is this particular Medakshaya and Pliha Vritti? Medakshaya means it is the that is what is considered to be the fat or adipose tissue, and Pliha Vritti, that is considered to be the enlargement of spleen. Is it possible to have the enlargement of the spleen in the person who is having the Medakshaya or the adipose tissue? That is the depreciation in the body. So let us see. When you look into the meda or accumulation of the fat, that is considered to be, there are various areas. For example, the one indicates the subcutaneous tissue, and second indicates the breast tissue, and third indicates the abdomen, fourth indicates the buttocks, and fifth indicates the that is the nape of the neck. So these are the different areas where the fat accumulation may be possible if a person is taking this particular this particular more and more nutritious food. So these are the areas where there will be a deposition of the fat, because this particular excess nutrient into the body, so that will be going into these different areas. When you think about the Medakshaya, so part of this we can able to learn by looking into this, what you say, that the alcohol consumption. When a person is doing the more and more amount of alcohol consumption, what will be happening? The person will be having the less amount of the food. When there is less amount of the food, the the source of the energy to the body is not carbohydrate. It is the fat which is being accumulated in these subcutaneous tissue, breast, abdomen, buttocks, and nape of neck, etc., etc., or even cheeks, etc. In these areas, so there will be the deposit, the deviation of this particular fat. So that means they are coming into the circulation, blood circulation, and from there, where it will be going? That will be going to the liver. When there is going into the liver, that means more and more accumulation of fat takes place in the liver. So that means there will be a fatty liver formation or fatty degeneration will be there. That is, it's an early phase of cirrhosis of liver. So when you think of the next phase of the cirrhosis of liver, what happens is there will be portal hypertension. Portal hypertension in the sense, because of the shrinkage of liver, the whatever these particular the blood that will be moving backwards to the portal vein. When there is the portal vein, that is the backward flow of the blood, What actually happens? That is, portal vein is consisting of two main veins, that is superior mesenteric vein and splenic vein. That is superior mesenteric vein and splenic vein. So here this superior mesenteric vein, there will be backflow in the sense that will be responsible for the increase in the size of the spleen. That is what is considered to be the splenomegaly. Whereas the backflow of the blood to the superior mesenteric vein, that will be considered to be the earliest sign that we are going to observe, that is the bleeding per rectum. That is frank blood per rectum may be the outcome of this. See, that is the medakshaya, that is simple decrease of the what is adipose tissue. So that is resulting in the mobilization of fat from these particular the adipose tissue, which are being deposited in the various areas, subcutaneous tissues, etc., etc., that is coming into the liver. From there it will be coming into the resulting in a cirrhosis of liver changes, portal hypertension, backflow of the blood to the splenic vein, resulting in the enlargement of the liver, the enlargement of the spleen, that is splenomegaly. This is how there is a relation we can able to make out medakshaya and plihavritti. Next regarding the vyayama and vata increase. Whenever if you look into the vyayama, or what we can say, that is exercise, if a person is doing the exercise, there will be two types of effects are possible: short term effects and long term effects. When you think of short term effects, that will be observed in the form of increase of chalaguna in the body. For example, the person will be having the more and more the breathing. Sometimes the person will be breathing through the open mouth. Sometimes if you feel the pulse, there will be increased pulsations we are going to observe, increased number of pulsations we are going to observe. So these are the different ways that we are going to observe as far as the short term effects are concerned. Whereas long term effect is concerned, so there will be the increase, there will be the lightness of the body will be there. So that means when a person is habituated to do vyayama, when that is responsible for the depletion of the fat tissue from the body. So that is, there will be fat mobilization, and the person will be having the lightness of the body, and because of that, we are going to see the increase of laghu, ruksha and kharaguna increase we are going to see. And as far as the features are concerned, clinical features are concerned, emaciation we can able to see, lightness of the body we can able to see. The person will feel like I am feeling very light, and fatigue because of the excess amount of the exercise. As the person, if the person is not taking adequate nutrients, there will be fatigue will be there. This is about the vyayama and vata increase. And next about the pranavasrotas and its effect and its relation with the vyayama, specifically during fasting. This is the description available in Charaka Samhita, one of the Ayurveda textbooks, right? So whenever if a person is doing the fasting, what will be happening? There will be the glucose depletion that will be there. If at all that is being present, within 30 minutes the glucose depletion will be there, which is in turn is responsible for the that is the fat mobilization may be there. And whenever if a person is doing the exercise, the immediate effect will be air hunger. The person will be breathing not only through the nose, the person will be breathing through the open mouth also, and sometimes even pursed lip breathing may be present. And when a person is doing the such kind of the breathing through the open mouth, there is a chance of entry of dust, smoke, etc., etc., to the lungs, because it is bypassing some of the filters. For example, the nostril, that is the hairs are present in the nostrils, inferior the turbinates, superior inferior turbinates, nasal turbinates, and so these are the that is what is considered to be the barriers that will be bypassing. So that means these entries that will be entering into the respiratory system directly, reducing the what do you say, that the cough, sputum, etc., etc. This is about the another understanding. Vyayama, the person is doing the vyayama specifically during the fasting, how that is responsible for the affliction of pranavaha srotas. So the take home message from today's session, that is, learning Ayurveda is like learning a new language. Whenever if you are learning a new language, first of all you have to start from the scratch. One small word, then elaborate it, and then because elaborate it with some known informations, that is the adding the unknown information to the known information, so that it will be helpful in developing that particular language. And learning Ayurveda and Western medicine is like connecting the two railway tracks at regular intervals. And three different examples that was being discussed today, that is fat depletion and splenomegaly, performing the exercise and the relation with the vata increase, and lastly the affliction of pranamahasrotas by doing strenuous exercise, specifically during fasting. That's all for today. So let us learn something new in the next video. So just share below what are the major key takeaways that you are going to take out from today's discussion, and what are the other information that you would like to learn in the coming videos. And if you are really loving this particular video, then share this particular video to maximum number of true Ayurveda learners, so that let us make a movement from this particular small message, so that every true Ayurveda learner can become can have a belief as well as practice Ayurveda. Because Ayurveda is not a simple medicine, Ayurveda is actually a lifestyle medicine. Thank you.